Welcome, family. In today's knowledge, let's talk about Hyperemesis gravidarum, one of the common complications of pregnancy. Watch till the end as I talk about who is at risk and many more. Please subscribe if you haven't. Like and share. Please share and share. When you find out you're pregnant, your thoughts and emotions may go into overdrive. You might be as excited about this new person you will bring into the world as you are terrified that something may go wrong. Most pregnancies progress without incident. But approximately 8% of all pregnancies involve complications that, if left untreated, may harm the mother or the baby. While some complications relate to health problems that existed before pregnancy, others occur unexpectedly and are unavoidable. It can be scary to hear that doctors have diagnosed a complication. You may be worried about your baby's health and your own health. You may even feel panic that perhaps something you did, or didn't do, caused this to happen. These feelings are completely normal. It may reassure you to know that nothing you did caused these complications. And beyond that, these complications are treatable. The best thing you can do for you and your baby is to get prenatal care from a provider you trust. With early detection and proper care, you increase the chances of keeping you and your baby healthy. What is Hyperemesis gravidarum? While many pregnant women experience morning sickness, nausea, possibly with vomiting, generally in the morning hours, and other discomforts during pregnancy, women with Hyperemesis gravidarum, HG, have morning sickness times 1000. HG is severe nausea that results in significant weight loss and may require hospitalization. Though it may not make you feel any better, know that if you have HG, you are in royal company. Her Royal Highness the Duchess of Cambridge, Kate Middleton, suffered from it. What are the symptoms? Women with HG have severe nausea and vomiting. The vomiting and reduced appetite leads to weight loss and dehydration. The major difference between HG and normal morning sickness is that HG results in a weight loss of 5% or more of your pre-pregnancy weight. Who is at risk? Doctors do not yet fully understand HG, what causes it or who is more likely to experience it. Can you prevent it? You cannot prevent HG, but you can take steps to control and manage it during your pregnancy. The most important thing you can do for you and your baby is to get regular prenatal care. HG can lead to not getting enough nutrients, which can be harmful to both you and your baby. However, with proper treatment, there are typically no long-term effects to either mom or child after the pregnancy. How is it treated? If you have been diagnosed with HG, the priority is ensuring you have enough nutrients to keep you and your baby healthy. For some women, a diet of bland foods and fluids may be enough, while others may need to take medication to help relieve the nausea. In severe cases, you may need to be hospitalized to receive nutrients and fluids via intravenous. You may feel down about having to be in the hospital during your pregnancy. But remember that you are just doing what you need to do to protect your and your baby's health. Many women start to feel better by the 20th week of pregnancy, while some continue to experience symptoms throughout the entire pregnancy. What should I ask my doctor? If you've had HG in the past, talk to your doctor when you are thinking about getting pregnant again. It's important to make sure you are physically, emotionally and psychologically ready to begin another pregnancy. If you had severe weight loss or other nutritional deficiencies, you'll need to talk to your doctor about making sure you are healthy before getting pregnant. Want to know more? Subscribe, like and share. Please share and share. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.